and welcome to What's Wrong with the Podcast. Today we're delighted to be talking to Dr. Maria Shifrin. Dr. Shifrin is a clinical psychologist located in Midtown Manhattan. She approaches her practice with both a sensitivity to the individual or couple's experience, as well as an understanding of the influential roles that family, society, and culture play. Though her expertise applies to helping a wide range of individuals, Maria's practice is geared towards providing care to moms, dads, and couples struggling with adjusting to and finding satisfaction in parenthood while balancing the pressures of everyday life. As a wife and mother of 3, Shifrin is a strong advocate for helping parents achieve and maintain mental well-being. Her ultimate goal is to help her clients recognize that they have control over their life, choices, and relationships. Maria, welcome.
Hi, thank you for having me.
It's lovely to have you here. So do tell us about yourself more.
Okay, so I am a clinical psychologist in private practice. I am a mom. That one should have been first. Mom of 3. I am currently trying to balance the 2, and it's been a fun trip. So I work in the city, but right now I'm virtual, as most people are. I think, me being a mom informs so much of my practice, and I am, really focused on helping moms and dads and couples really kind of navigate parenting stresses and everything that comes with the shift into motherhood, parenthood, and being a couple before and after having kids.
Perfect. And this is also why we have you here today, because it was or has been very stressful indeed for families in general. So I guess in the context of post-lockdown and Corona times, because it's also not over, what are some of the common issues that you've witnessed either with your patients or like even within your own family that families go through?
So I think it's interesting because it's shifted. When you and I first connected, we were really, mid-lockdown, and
Yes.
It seemed like it was uncertain, but in many ways, there were some clear-cut guidelines. We knew we had to avoid people, we had to stay quarantined, we knew we had to sanitize everything and stay away from people. We were teaching our kids that and trying to navigate that. But what I found now recently, families struggling with is this kind of uncertain area now. We're in this gray kind of post-pandemic. It was very clear what we were supposed to do, what we weren't supposed to do. And now I'm finding that many people are struggling with navigating this kind of post-pandemic stress, or, I hesitate to call it trauma. For some people, sure. But for a lot of people, it's this post-pandemic stress of what do we do? The decisions are become very individual. Parents and couples are really trying to figure out where their levels of comfort lie. And I can't even tell you how many people I've met now, like in local areas in my personal life, and also patients have been telling me that they and their significant other, their spouse, have very differing comfort levels on where to go and what to do. Who do we see? Who do we socialize with? What do we allow our kids to do? Do we send them to camp? Do we send them to a private pod that is now, replacing camp? Do we let them see my parents who just came back from Florida a week ago? Because my husband would do it, but I won't do it. Or my wife is really nervous, but I'm okay with it. And I think people are now, struggling with what to do and how to make these decisions and how to navigate them and how to kind of compromise, because this feels like a huge compromise. There's a lot at stake.
It's honestly so interesting, because even though we have all been living this, I haven't thought about it in that sense. Whereas like suddenly, while like couples and parents maybe like decide on one thing a day at a time in the past, now it's suddenly like it's health issues, it's social issues, it's about work. Because especially if there are partners that have never seen each other work or have worked together before, suddenly that life is also mixed. Yes. All social life is like everything just like is thrown into the same pot, and you're kind of just like figuring out. So I never actually thought about it in that context. And how are children taking this in the meantime?
Exactly. I think children are also starting to get a little bit, some are, it depends on the kid too, right? Like some kids are really adaptable and adjust more easily than others, and some kids need their structure, they need their guidelines, they need to know that this is what's happening today, tomorrow. And you're telling kids school starting soon, but what that actually means in their minds, they have no idea what to expect, and we don't really know what to tell them because we don't know. I'm getting emails every 2 days from our superintendent saying we still don't know. And so I guess you have to figure out how to communicate with your kids what it's like to sit with that uncertainty, but also to somehow prepare them for a school that's going to look very different. And it gets really complicated, and right now people are really deciding what they're doing, right? Are they sending their kids, are they not sending their kids? What is every district going to do with schools? And it's really complex, and I meet people again all the time, whose kids are in camp and whose kids are not in camp, and some people are very judgmental and some people are very open, and this is where the parenting piece comes in, and it's so important to be working on yourselves and be aware of how you manage uncertainty and how you manage this stressful time, because they really absorb it. No matter what age they are, they absorb it. And it's on us to figure out how we can communicate better, communicate amongst ourselves, because we model for them, of course, how to both manage stress internally, but also how we deal with our partners interpersonally, and how we deal with extended family who are trying to either push their way in or, depending on what's going on in the extended family dynamic, but there's that too. And I think it's important to recognize, how do you talk to your kid? Like, who is your kid? How do they manage stress? What are they manifesting? Because there have been many kids during this time who've ended up in therapy, or families who've had to do virtual family therapy or have consultations because it's been so difficult for the kids to manage this change in routine. But understanding that, with younger kids, of course, you have to be a little bit more concrete and a little bit more, playful and safety focused and a little more positive. And with older kids, a little bit more real and a little bit more, communicative of some of the more negative stuff you might want to shield the little ones from in some way. But I think the kind of the underlying piece that applies to all ages is being real, just being real and being genuine and being honest, and modeling for them that you can both be scared and uncertain and unsure, but also, aware and in control of the things that we can control, and kind of really, really telling them that there are always aspects to life that we are able to manage and we are able to have some power over, and let's focus on what we have power over and kind of work together to kind of ground ourselves in that.
Right. So while all of this is happening with parents, how are children taking it? And considering that we're saying children, but that's a big age range. And I guess biologically and psychologically, they can all take it very differently, right?
Yes, I think that, we have to be very mindful of the age range of how we present information to them and how we present ourselves to them. In some ways, I wouldn't modulate our actual real responses, but I do think that when we're thinking about kids, we have to be a little bit more, I guess, concrete and playful and, more descriptive with younger kids, and a little bit more real and genuine and kind of gritty and honest as the kids get older and older. And you also have to gauge the maturity of your kid. You could have a really mature 7-8-year-old and a very immature, fearful 13-year-old, and you might have to kind of figure out how you approach each kid as an individual. But yes.
That is so important, because what we've been discussing also in the studio, as we're sort of rethinking what life from home could be for working parents. And we've been doing these studies and research, and one thing that it keeps popping up is sort of parents assuming things about their children, which inhibits communication.
Yes.
And also deciding themselves what should they know or don't know. And you mentioned, honesty and more open communication. I have a feeling we underestimate how much they understand and how much we should communicate, and what the balance is between shielding them and sharing with them.
Yeah.
Right?
Yeah. I think that part of that underestimation is a real, it's like a mistaken focus on what we say versus how we say it and what we're
Oh,
feeling. And I think you're right. We absolutely underestimate our kids because I think they understand so much, but a lot of it is on a kind of unconscious, nonverbal level. And no matter
right.
what we tell them, they will still pick up on our anxiety or our anger or our conflict or whatever we're trying to shield them from. Most likely, they'll be feeling it, but we haven't done the job of communicating it in words that they can understand and metabolize. So it actually confuses them more. Like if they're feeling stress in the house and you tell them everything's okay, that they're not going to metabolize that properly. They're going to make up some explanation that's probably incorrect and really immature and developmentally appropriate for them, but it doesn't contextualize what's actually happening in their lives. So you're doing them a disservice in many ways
Oh,
by
wow.
not being real and honest with them. Again, age appropriately real and honest.
Right. Right.
You
Right.
also don't want to steal their childhood naivete and tell them everything that's happening.
Right. And it's so interesting you said it's not about necessarily like what you say, but how you say it. And basically be honest, not necessarily about all the facts of the world, but more like about your feelings at the moment. No, like
Yes,
that's actually
yes.
what, because like it's so funny you say that. I have like vivid memories of my childhood. Let's say like I have like an important concert at, my 6-year-old self. And my mom is like stressed on my behalf. Like I remember, and she would never say anything, but I remember not being able to look at her because I could
Mm-hmm.
read her face, which was
Mm-hmm.
like shouting anxiety, and
Yeah.
I guess like if she had just said like, oh, I'm nervous for you, or like, excited or whatever, maybe I wouldn't be like, so like, okay, I can't look at my mom right now.
Yeah, because you're having an emotional experience that wasn't contextualized in words, right? It wasn't like normalized or contextualized, and you're left trying to figure out how to cope with this anxiety on your
That's
own.
so interesting. And I think like considering the extent of time this is happening, right? Like there's still so much uncertainty. We don't
Yeah.
even know what's going to happen. There's no vaccine. Like there are so many things we can freak out about. Like if it's just like a constant on an ongoing basis, like forget like how the children feel at the moment, or not being able to being sure of how they can behave. But what are some potential, I guess, long-term risks, so to speak, like in terms of like character development, or I don't know, like any like psychological issues that may arise from like an extended period of time of stress or uncertainty that is like reflected on children?
Yeah. I mean, I think for children just as well as adults, young adults, older adults, when you're talking about extended periods of stress or kind of a hyper vigilance, if you call it, that's really like a post-traumatic stress type of response, right? Like a PTSD.
Yeah.
um, and it is definitely something to be aware of. And again, the risks or kind of the vulnerabilities that make people susceptible to long-term effects are underlying issues, are a home or a household that's already having so much stress and anxiety and kind of unprocessed high emotion where they can't think or feel straight. I think it makes a big difference if you label things, if you label the emotion, if you label what's happening, you label the conflict, then the long-term effects are a lot less severe and persistent, and they could be resolved and worked through. Like there's a difference between a home where parents are running around crazed, anxious, yelling,
Right.
screaming, and telling their kids to get out of the room every time they get a phone call, and then never talk about that and expect the kid to just go to sleep, wake up, and be quote unquote normal the next day, versus where that can also happen in a very high functioning household, but the parent at the end of the day can say, we were super busy today and mommy kind of lost it, or daddy was not able to handle his feelings, and we lost it, we didn't control ourselves, and we could do better next time, and maybe we should use a timeout, or we could have used some deep breathing exercises, but it's a stressful time. And you kind of explain to them and honestly tell them that adults also get anxious, adults worry, adults misbehave, adults can apologize. And then a kid could say, okay, when I get anxious and I get stressed, I can also make mistakes, but that doesn't make me, a bad kid, a bad person, a nuisance.
Mm-hmm.
And they don't create these stories about themselves that are negative and that persist. And those are the things that end up leaving them vulnerable to, later depression or anxiety or, other kinds of issues in the future. But yes,
Right.
I think persistent stress, living under circumstances where you're fearful and you're unsure and you're nervous, I think kids are going to feel this for a while. I think we all will. I think we're all going to take some time to readjust, and we have to be really kind and compassionate with ourselves and
Right.
not think that we need to have it all together in order for our kids to have it all together, and not expect that they're going to be resilient as kids are and be totally fine, sitting in these shielded desks with masks on, not interacting. Like, that's not going to be fine. They're going to have some stress, they're going to have some
Right.
issues, they're going to probably rebel and misbehave and have, some outbursts. I'm sure kids are going to have some trouble readjusting to the new normal.
And more the reason why I guess we have to be more open about how we feel and communicate it. So this is not, I guess, like try to be buried within or so internalized that we collectively can't get over it in the future too.
Right.
And it's I guess like you touched upon, parents being stressed when they get a call kicking out children. So I think it was also interesting to see, in addition to obvious like the health concern, and the uncertainties around that, one of the top reasons why parents have been so stressed is how do we manage work.
Mm-hmm.
And this could happen either like they actually really are busy and need to get work done, or they have a certain idea of how work should look and suddenly that was disrupted. Or if it's about just the calls or like, meetings with their either team members or clients, it was about like, how will I be perceived by others? Will this look professional? What do children really need to make this work? How can we be collaborative with, if you are a single parent, if you have multiple children, if you have, like children in like varying different ages, so their needs are different. So there's still like a big gap on information about all of that. And it looks like parents are really just trying to figure out by themselves and assuming everybody else figured it out somehow, if they
Yes.
don't see chaos on the other side of the call.
Mm-hmm.
But it also makes me think, like last time we were talking, you were hiding in a closet. So
Mm-hmm.
if you hadn't told me that, I would totally think, okay, she has, figured
Uh-huh.
but it's like our own assumptions also like putting
Yes.
us in stress. So I guess like, what is your point of view in terms of sort of, I guess, first of all, starting to accept as parents like the situation, and then moving on to more of a collaborative scenario rather than like, how can I like save 1 hour from children so that I can work?
Yeah, I think, there's so many angles that you could take this from, but the thing that came to me is what we were saying before about, or I was saying, this shift, this kind of more opening your borders up a little bit more, that I've seen, so many of these emails now going on about pods, about setting up, teaching. But that in and of itself, I think that now people feel a little bit more comfortable calling in the collective or calling in the village, and I think that's what we've started
Yeah.
to realize, like a lot of this social comparison piece of thinking, well, they have it together somehow and I don't. It was done in isolation. It was like, I'm here, I have to figure this out because this other mom has figured it out and they've done it, or this couple must have a wonderful relationship because they seem to be seamlessly going in and out, where like you don't understand what's happening in those 5 minutes that they seamlessly transition. There must, and I think that now people, what I've experienced in my personal life too, is like other people, friends, neighbors, classmates, moms, reaching out, mostly moms, to be honest with you, reaching out to other moms and saying, how can I help? Can I take the kids to play in the backyard? Are your kids in camp? If they're not, maybe, there's this student who's gathering a small group of kids and playing a sport. And I think that some of us, and I also can recognize that I'm really lucky and privileged to have that. and not everybody has that. But I think that once part of what's helping is people are opening up a little bit and allowing others to help them, because it is not, I think I learned that it's impossible in isolation. I mean, literally, it's impossible to
Yeah.
do it on your own. You either have to open up and hire somebody who can come and help you, and that everything that you do nowadays, I feel like has a risk, and you have to be really open and honest with yourself about what risks you're willing to take in order to do this, in order to do it. And it does have to be done in collaboration with kids, because, for example, one person's kids are open and outgoing and have no problem with having another mom pick them up and take them to another person to their house and playing all day.
Right.
Whereas I know other parents who are like, my kid is really shy and she won't go, or he won't go, and I have to be there with them all day. They have to have one person watching them. I think, again, you have to be open and accepting of your kid. The worst thing you could do is push a shy, introverted kid into a social situation because you need to get that couple hours in for work. And I get that so many moms just don't have options. Like, they have to get childcare. They have to do something in order to make money. And, we all have to figure it out. But so much of the answer right now is trying to figure out what you can do to call in some help, from anyone that's willing to do it, or be the one to offer it.
Right. Right. Or even, like, as you said, speak up about it, because
Yes.
I feel like, at least one silver lining of this entire situation is that it sort of is the end of, I don't want to say even perfection, but like pretension as we know it. Like,
Yeah.
we are all human beings. I mean, we may act very professionally, we may behave in a certain way in a certain context, but when all of that context blends, there is no way no one could assume that, everything, you're going to be the old self that we knew you at the office.
Yes.
And I think it's normal now if people see cats or dogs jumping up into like Zoom. And I think in the past, if we had seen like children coming and asking you something or interrupting, it would have been like, at least some work environments, it would have been definitely a problem. But as now, like, what are they going to say? What is anyone going to say, really?
Right.
Especially if you're also delivering your work. I think it sort of like pushes the corporate structure and the mindset of how we work. And I almost feel like, similar to like reaching out to the community, it's a hard thing to do, but we really don't have any option. Just like speak up about the reality.
Right.
And really just openly share. Obviously, like, if it turns into like you being able to not deliver any work, maybe that becomes an issue. But like those minor things where moms, especially moms, like stress so much about like, oh, I can't be interrupted during this call, oh, it's a client, it won't look nice, or whatever that is. Like,
Mm-hmm.
I think that we're sort of imposing that on ourselves.
Yes.
And that reflects.
You're 100% right. And this actually, there was an old experiment. I'm going to be probably way off on the numbers, maybe 70s, 60s, by Ed Tronick. He's a famous researcher. It's called the still face experiment. These are with babies, but I think what you're talking about is some extension of this, where mom is present, mom is smiling, mom is responding to the baby's natural cues, and then he tells the mom to just get still faced, so no response. And this completely creates like an internal sense of chaos and panic for the baby. The babies get so dysregulated. It's so terrifying for kids when they kind of lose that person that's in front of them. And to them, it's like it's a real psychic anxiety. It's like a panic attack in many ways.
Oh my God.
And what you're describing is so real. It's so happening on an emotional level. Their mom is there, mom is mom. And then all of a sudden there's this invisible wall, like you said, and mom is not here. For all intents and purposes, she's not here. What am I going to do? I'm scared, I'm alone. And to us, it's like, I'm right here, kid, take it easy, have a snack. But to them, it's like a psychic thing. It's a real sort of deep-rooted fear that psychologically, mom is gone, and I don't know if she's coming back. Yeah.
So interesting. Uh,
Yeah.
and of
Yeah.
course, then they're trying to desperately get attention.
Of course.
Like, what crazy thing can I do so that mom's side sort of like bring mom back to life? Like, I guess it's sort of, it's really interesting. And I'm sure like so much in the moment of that stress of trying to get work done, it's really hard to recognize that, but it's like, but the underlying reason is so innocent and just comes from like pure emotions.
Yeah.
I think that's really interesting. It goes back to what you said so much on communication, just really how can we sort of, I guess, and to also to your point in like setting expectations.
Yes.
So it's almost like, it seems like if the day starts similar to like a meeting with your team members, if a day starts like with a meeting with
Mm-hmm.
your child, like this is what our day looks like,
Mm-hmm.
probably going to have a call. Now, of course, I guess depends on the age range, but
Yes.
really like communicating this from the beginning, setting expectations. So I guess like going back to communication, how can we be collaborative? You mentioned it, touched upon it a little bit, but how do you see that sort of, I guess, dispersed into a day, or like, you know, maybe it starts in the morning, and how can there be like quality touch points so that this everything seems more in a bit control for the children as well.
Yeah. Well, I think one important factor, and you'll see this in every single like self-help parenting book, is special time, right? Dedicated time to each kid, which is, it's super hard to do. And I'll tell you, even from personal experience, I have like high ambitions for myself, and I fail miserably so often. But when I do it, you can see the results so quickly. So just like you have your work time, this is the time that mommy's working on her call. When I am not, at, let's say, 1:30 p.m. if your kid could tell time, or in a few, however you could sort of break the day up into for your kid depending on their age, they know they have a dedicated time. They know they have your attention, your focus. That really makes a big difference. If you could sort of start the day, depending on how early you start work, if you can give them a couple of minutes and, like you said, plan, huddle
Yeah.
together. This is what we're doing. This is what you can expect. This is when I'm going to be on a work call. I can't be interrupted. I can't be there for you in the way that you need me. However you communicate that to your kid, but also making sure you schedule in dedicated time, schedule in time for them, so they know that they have something to look forward to. If you can do that, I think
Right.
that would be like my number one suggestion. If you can communicate to them that you will be unavailable, but you will also make sure to make yourself available to them, and do it, and the behavior, I mean, they will start to adjust. They might not be able to tell time. They can't say, oh, here's 2:00, you promised me 10 minutes of mommy and me time, but they'll know that it's happening at some point. Or like, my kids have this thing where my husband he would go for a bike ride with them when he got home from work, and they knew that it was sometime at night, but it was like, when daddy comes home from work, we're going to have a bike ride. And they
Right.
knew that they had that dedicated time to do the thing that they wanted to do. And kind of like, this is sort of a tangent, but it kind of goes back to the whole point of switching between work mode and mom mode or parent
Right.
mode. I think that we all started out this pandemic, all of us who had to work from home, trying really hard to separate the work self and the mom self and the like spouse self and whatever it is. And psychologically, I think that protects us in many ways, because we can kind of be one way in one context, and we don't have to
Right.
carry the things we don't like or the conflicts we have into another. We kind of like shed these issues at home, come back to it later. But the more
Right.
this continues, there's like this meshing of the selves that before felt scary and uncomfortable. And now, as you're telling me about these experiments, made me think, I think that we're allowing ourselves to be our kind of flawed, imperfect self in different contexts. And it's less and less uncomfortable because we're now just forced to be exposed to it.
Right. Right.
Yeah, like if your kid is in the room, it doesn't make you a terrible, professional. It doesn't make you unprofessional. It doesn't make you worse at delivering the work
Right.
that you. And I think that part of that is like letting your kids in physically, but also in a way that you can communicate with them. Like, all right, this is happening. This is our new way of normal. this is mommy when she's working, and this is what's going to happen, and this is mommy when she's not. And I can admit when I was mean, or I can admit that I was a little, worked up and didn't handle myself very well, but I'm available to you now. So I know this is not the best answer, and I think it's very dependent on each family and each dynamic. But a lot of it comes down to being open to who you are in your different selves and allowing them to come together, and talking through that sometimes with your kid, and making sure that they have some structure, some understanding of when you'll be available and when you won't be available to them.
Right. I think a lot of it goes to your point in saying, like, taking ownership if you actually screw up. Like, if you, because that's
Which
also,
you will, we will. I mean, we do all the time.
Exactly. And, it goes to the core of, like, I guess, even something more fundamental, that is trust, right? Like, if mommy said we have us time at 2 p.m., it's 2:15, she's not here yet, freak out can happen for even like more internal reasons. Or if you sort of act out on something and sort of not communicate or try to cover it, or sugarcoat it, like it's I don't know if this really creates mistrust, but it seems like, well, that didn't feel like that though. Like, I think there's some like questioning could start easily. Like, even as adults, like, if we feel like someone keeps like yelling at us, they look very stressed, and then if we ask what's wrong with you, if they say nothing, we're never going to believe them. So it's kind of that, like, going back to, yes, you messed a bit, you basically try to make best out of the day, and then you go, in the end, assess at the end of the day and be like, okay, maybe that wasn't. So it really actually calls for sort of like a pause, and really trying to, okay, maybe that wasn't fair, that was a bit too much, this went well, sort of like this. And almost like, if you're starting the day with a meeting, ending the day almost with an assessment too, like, again, collaborative.
Yes.
That could even, like, if that becomes a pattern, I can almost see, like, from those interviews we did too, like, children could easily be like, mommy, this didn't go well today. And like internal meetings, I think, could be like very interesting. But it goes to, like, then how, I guess, as designers, if we're trying to like create these tools that can help parents and children, it goes to both like taking care of your stress and your own health and reminders of things, as well as like these tools that enable a collaborative, maybe scheduling, communication, like things that encourage communication. But in the end, they have to be like these tools that somehow need to be adapted to whoever, like, however the scenarios change, right? We talked about like different family setups, like different type of parenting, number of children, age differences. Considering like this is the new normal, at least for a while still, what would be a very quick advice that you want to give to parents to ensure it's a more collaborative household?
I would say making sure that you are aware of your assumptions, of what you are kind of putting into the situation, what you are assuming about what other people are thinking, kids, spouses, anyone who lives in your home included. Checking in and trying to kind of reflect on where your assumption is coming from. Is it based on reality, or is it based on some past event that you're bringing into this current situation? And being super flexible. I think, rigidity and presumptiveness are our enemies. If you cannot be flexible, if you need to be right, you need to work on that. If your assumption is wrong, you have to be flexible and accept that your assumption was wrong, and move on, kind of, work together to do it differently next time. Not beat yourself up, not say you did a terrible job, I was a terrible mom today. Because we talk a lot about these ideals, like it would be ideal to have a schedule and stick to it, but things come up like
all the time.
And sometimes you're not going to be there after lunch for the mommy and me time the way you promised, and it's going to suck and you're going to feel really bad. But you have to be flexible with yourself if you're going to teach your kids to be flexible with themselves. You tell them, I messed up, and we'll do better tomorrow. I'm going to try, or let's figure out how we can do this together, or let's think of a new schedule, or anything, anything that allows you to be flexible, to check in with them. And sometimes, again, like you said, this word assumption, you assume it was devastating for them, but ultimately they're like more upset that they didn't get the popsicle flavor they wanted, I think
Right.
we really, really do a number on ourselves with the mom guilt.
1000%. Thank you so much, Maria.
Yeah.
This was so much fun.
Thank you. Yeah, it was great.
That is this week's episode of What's Wrong with the Podcast. Make sure to visit our website, podcast.what'swrongwith.xyz, and subscribe to the show on Apple Podcasts, Spotify, or Google Podcasts so you never miss an episode. If you found value in this show, we would really appreciate if you could head over to iTunes to rate and leave a review, or you can simply tell your friends about the show. For more details on our guests, follow us on Instagram and Twitter. Links can be found in the episode description. Don't forget to join us next week. Thank you for listening.